Well, welcome, ladies and gentlemen. Again, thank you so much for another great evening that we have got here in Australia. And in fact, we are pipelining around the world. Tonight, I have an incredible speaker, guys. And, it's taken me months and months to get this gentleman online with us, okay? He has a very busy practice in Melbourne, Australia. I had the absolute pleasure of meeting him about 3 months ago, and I was blown away just within his own knowledge, the knowledge that this man brings to the table or brings to the wellness profession here in Australia and in fact around the world, as we're now doing global Zoom conferencing, obviously with people and also patients in practice these days. Dr. Idris, I truly appreciate your time, energy and effort for coming on and speaking with us tonight.
Thank you so much, Robert.
Hey, listen, what I want to do, mate, I've got your list here and your resume is bigger than the whole dictionary itself, okay? For a man that's 28, I mean, I can't believe what you've done in your life, okay? It's mind-blowing. But Dr. Idris, what I like to do, and I always ask my speakers, can you just give us a 1 minute history lesson of what you've achieved in life? And then I want to talk about the Zenzino journey with you.
Thank you very much. Well, I'm a naturopath, and most of my career has been in the wellness industry. Specifically, one of my passions is, as a formulation scientist, looking at the way that supplements are developed and looking at formulas and how they can better our life today. And that's really most of my career. It's not only my career, it's been my passion, actually. So I do have a practice here in Melbourne. I see patients around the world, and I'm very, very happy to be on this Zoom with you tonight, Robert.
Fantastic, my friend. Look, and it's great to see, and Rena tapped on a few of the key things that are happening within your life, okay? The amount of lectures that you've actually given, the research that you've done personally yourself to get yourself into, the medical world and into this point where you now have a full practice in operation in Melbourne. And, you're seeing amazing results with people with all different types of ailments. And the first one I want to tap on, okay, is the heart. I want to talk about what are some of the things with the Omega world that you've been seeing with the heart. And from that as well, we, through our discussions, you spoke about Zenzino did come into your life at the right time because you're at that pinnacle point of making a decision that all the Omega out there is not really what they should be.
Yeah, that's right. It's a funny story. Just the week before, actually, I was talking to my wife about how I was unhappy with the selection that I had. And in Australia, that's almost a crazy thing to think about. We, are in a very fortunate country here. We're the only country in the world that has prescription quality, practitioner-only supplements are available. These are things that you can't even find on the shelf in a health food shop. They need to be prescribed by a naturopath or someone with those sort of qualifications. And although we have really supremely fantastic products out there with great research, the Omega department was just lacking so much. And about a week later, this product basically fell into my lap. Being partly Norwegian myself, I was very happy to know that the product is hailing from Norway, where we have some of the cleanest waters in the world. And it's not only, as we know, we do call it an Omega product, but it's so much more than that with the polyphenols and with the vitamin D. So when we look at the heart, the heart is everything, isn't it? It gives us life. It pumps our blood throughout our body. And when you look at the heart, and it's an interesting thing that when you look at the medical profession today, me as a naturopath and someone who's trained in herbal medicine and nutrition and these sorts of things, I'm always amazed to see when we have the allopathic health sector, the mainstream medical doctors, the GPs, the cardiologists, the rheumatologists, who are suggesting and telling their patients, you need to get on an Omega product supplement. And so, and that's just because when we look at the heart, there is so many functions that we know now from research that Omegas do for the heart. For example, they help to correct abnormal rhythms. And when you think about it, a lot of people go to a hospital and present with heart palpitations or strange little, even if it's just once or twice in their life, an abnormal rhythm. Another, brilliant thing that omegas can do is they increase the function of our arteries, and they also increase the compliance of arteries. So many people are walking around today not having a clue that they have compromised arterial health, which of course is going to lead one day to cardiac events and stroke and things like this. One of the major things that most people probably know already, one of the beautiful things that omegas do is they help to balance the good and the bad cholesterol in the body. They increase the the lipoprotein, which is basically that process of good and bad cholesterol. They allow for more blood flow, which is increasingly important. One of the things about being a younger person, which is a benefit, is to have increased nitric oxide production. And although omegas don't increase nitric oxide production itself, they act very similar by helping to, in some cases, increase blood flow, and also decreasing low blood pressure, which is obviously a big problem. We've got so many people today in the clinic. I think probably every second or third person has themselves or family members, what are your health problems? I've got cholesterol, I've got high blood pressure. So, humble little omega-3 has the ability to do these things. And then, of course, when we look at it from more of, I guess, a biochemical point of view, omega-3 has this amazing ability to work with the inflammatory markers in the body. There's a lot of people that come in my clinic after seeing, for example, a GP, and they might have had a random blood test, and one of those blood tests is called CRP. It's looking at CRP, which is one of the inflammatory markers in the body. It's basically produced by enzymes from the liver. And another one is interleukin-6. So these are inflammatory markers that we always watch out for, because they can be the precursors of really serious conditions. Well, again, omega-3s are going to help to downregulate these markers. And of course, just touching on arterial health, like we said before, looking to help to dissolve down and break down some of that arterial plaque. So when you think about the heart, you can't think of anything better than an omega-3, amazing.
Well, and that's the interesting factor that I've found actually in the last, nearly 30 months I've been involved with Zenzino and its incredible products around the world, that I always like to start with the heart, because as we all know, okay, or if you don't know, as a guest that's listening, your heart is pretty well the last thing that gives away as your body function closes down. So, or if you have a heart attack first up, it's normally you're dead and it's done, okay? So it's the first thing that will collapse on you if you have some blockage there. The beautiful thing that I've seen with the omegas, okay, from the Zenzino range, from the balanced oil range, is that you're able to test, okay, and Dr. Idris, I put it very simply because, I've seen a lot of things in the wellness world now for the last 22 years. I've been personally involved on this side of the fence of, helping people have some great products in their system to repair their heart, their immune, and their brain function within their body. But the incredible thing I saw with this balance test, okay, from the Zenzino range, it holds the omega-3 industry accountable for the inferior products they sell on a daily basis. Now, I'm not saying that you were selling bad products, but you're already proving with the products that you had in practice, you sort of said, hey, I need to get some better products. I need to find something that, is not 5, 6, 10 tablets a day, to get them down your throat and into your body. This test is holding the omega industry accountable for those poor formulations. Can you talk to me just quickly as we move on to the immune system, how the balance test has worked effectively with your patients and in your practice?
I absolutely love this test. Look, we've had for some time the ability to test omega-3 lipid profiles in body. And we can even do, there are some companies, some pathology labs that allow for a comparison between the ratio of omega-6 to omega-3. And we know that as the balance, and that's obviously something which is really, has inspired Zenzino to create this product. It's been something that nutritional scientists and the medical industry has worried about for some time, is this great problem with this unbalanced state that a lot of people are in. However, something that this test does, which is very unique, is it gives you a full ratio of 11 different lipid profiles. And my absolute favorite component of this is the cell membrane fluidity test section, where it looks at the health of your cells. If you do not have healthy cells, you're not going to be a healthy individual. We have over 100,000 trillion cells in our body, muscle cells, brain cells, skin cells. We've got cells doing all sorts of things. And one thing that they all have in common is this semi-permeable membrane, this outer shell, which acts as a little bit like a bodyguard. If that membrane is hard and is not soft and flexible enough to absorb nutrients, you're not going to be absorbing the good quality food that you're trying to feed yourself. And furthermore, if that membrane again is still hard and solid, is not able to expel some of its own toxins and waste and pollutions that it's creating, because these cells are like little mini factories, where you're going to have very, very sick little cells, which makes you a very sick individual. So I love the fact that this test is not only really affordable, considering there's so much information in it, but that cell membrane fluidity section, to me, I just love it, and I get really passionate to explain it to my patients that this is literally looking at the quality of your entire body, because you're made up of cells, trillions of them.
Yeah, look, it's critical, and I see that as well with the amount of people that are coming through, and I'm very fortunate because I see the hundreds and hundreds of tests that come through my office here in Brisbane, where it's all controlled from and then sent to Norway, on a Tuesday and a Thursday. It's just amazing to see the growth of how many people are actually saying, I want a starting point, and then, as you know, the cell turn is 120 days. So with your red blood cell system, 120 days later, it regenerates itself. A good cell, once it's in good condition, will continue to grow and nourish itself to the maximum result you can get. And that's what you said about that cell membrane fluidity, of allowing that membrane to be able to take in the good nutrients, because, how many people are taking nutrition and it's actually not getting into the cell system? And when they see that on that 22-page detailed report, they then go, oh, now I understand. And then their body, in 120 days later, starts to really start performing, because their cell system is regenerating at a much better system than what it was 120 days before. Now, let's talk about the immune system, okay? We got this crazy thing that, and thank you, God, Allah, everybody you want to say in the world, okay? I'll go to every religion possible. And if you're not a believer, I'll take that as well. But whoever handballed Zenzino, okay, COVID-19, we thank them, because we're in a great immune boosting product, and everybody searching immune are seeing the Zenzino name, and we're seeing amazing results. Again, we're one of the only companies that have a balanced test, the Zenzino immune testing, where we can test the results of your cell structure and then help you rebuild that. Let's talk about that immune boosting, okay? The people that you remember how people used to get the cold and the flu? I don't know. They get COVID now. They don't get the cold and flu, okay? No, I just think it's a cooler name. It's just a much cooler name, okay? Only kidding. But again, guys, let's talk about that, Idris, okay? Dr. Idris, about the immune system, and particularly you guys in Melbourne and our good friends in Sydney, what we're seeing in Sydney at the moment. We just got to get the immune system built of everybody possible that you know. Talk to me about some of the results you've seen in the immune area.
Well, at first you think about omega-3, and most of us would think, what on earth would an omega do for our immune system? Well, as it turns out, there's a lot. A very important thing that happens that omega-3s have the ability to influence is our immune cells directly, specifically our white blood cells and something specifically called B cells. These have a big impact on our immunity overall. Another thing that we see with omega-3 lipids is that they allow for selective antibody production. So they can change and alter the antibody production that's needed for the body to work and, in defense of some type of pathogen. Pathogen meaning bacteria, fungus, and the big V word, virus. Another really amazing thing, and this is something you might want to look into yourself, a very cool function here is pathogen clearance, which is the body's ability to eat up, gobble up, and to clear out pathogens that have entered the body. So you can imagine that, there are some people walking around. In fact, all of us every single minute of the day are probably coming in contact with different types of pathogens. And our body's immune system, has this pathogen clearance, delivery system, if you like. And that's something that omega-3 lipids specifically influence in a great way. Another thing is, these wonderful omega lipids produce these pro-inflammatory cytokines. And they have a really cool function where they decrease the viral cell entry. So what does that mean? If you can decrease the viral cell entry, that means, hey guys, these viruses are not going to be entering your cells so easily. They're going to have some bodyguards that stick up to them and stop that. For those of you who know, bacteria live on the outside of the cell, free floating away around, our system. Viruses are very different, however, because they enter the cell, and that's why they cause so much, dramas and problems like that. And that's, on another note, why modern medicine has no effective ability to treat viruses. They can try and, vaccinate, they can try and reduce the risk and settle down the immune function that's happening, for example, with HIV as an example. They can tone down that immune response, but there is no cure for any virus at all. We're talking about, COVID, of course, but we're also talking about the common cold and things like, herpes and cold sores and all these sorts of stuff. So again, omega lipids help to decrease that viral cell entry. And then lastly, I just want to kind of close off here in this immunity section with something that's pretty cool that I only discovered, not that long ago. So our DNA has these beautiful double helix structure. I'm sure we're all familiar with that, the way that DNA looks. And at the end of DNA is something called a telomere. And telomere is basically that encode. And as we age and as we're, we're around environmental stresses and stress itself and all the things that life throws at us, these telomeres crack up, shorten, and fall away. Well, guess what? Omega-3s also have an ability, and there's not many things in the botanical world that we know do this, but omega-3s do help to increase and lengthen the telomere strand. So if you're able to lengthen that telomere, you're basically prolonging life. You're increasing the quality of that life too. So it's a pretty little cool thing there, not specific to immunity, but our overall genetic and DNA health.
Yeah, look, and it's fascinating because as you touch on that telomere, structure within the body, Zenzino, one of its global new products that's just been released called Xenogene. It certainly works within that region as well to help develop that area of those telomeres to get the strength in those extra parts of the cell working and functioning correctly. So as what we call a spring clean of your system, cleaning out the dead cells that have committed suicide inside your body, okay? And you got to flush them out. And this incredible new global product that Zenzino's released just recently, we're seeing some outstanding results so far in the first, sort of 6 to 8 weeks of the, just the research on what we call our people study. In other words, people that are taking the balance test, the Zenzino balance test, and we're seeing their results coming through very, very rapidly with the cell structures just replenishing at an incredible rate. The next one we talk about, obviously, is the brain function. And Dr. Idris, I'm going to talk about a person that actually through the customer program came to me and had mad cow disease through one of our partners out there, the people that actually talk to people about these incredible products and refer them to our company as customers. He came to me as a customer, caught mad cow disease a number of years ago. His doctor just recently basically said, listen, there's nothing I can do for you. Just go away. Your memory's actually, dropping, year by year. It's getting, worse and worse. He came on board and somebody, said, hey, give Rob a call and have a chat to him about the product. So I actually got him to do 4 tests. We're at our 3rd test now. So day 1, day 30, day 60, day 90, and we're doing one at day 120. His brain function, as we talk about brain, has improved dramatically. He's now got his brain function. And again, I'm not making any medical claims here, guys. It's just omegas and balanced oils working the way they should in your body correctly to rebuild the structure or that fluidity around your brain cells. Let's talk about some of the things that you've seen in clinic as well. This gentleman, I'm documenting his case. And guys, he'll do a public testimony for us, but incredible results that he's seen personally. And he's like his cell structure, like you said, Dr. Idris, month by month, it's just repairing. So all that damage from the toxins and the poisons that had been put into his body, you can see his body just, cleansing it. And I can't wait to day 120 where we have the first cycle of the red blood system. Talk to me about what you've seen in clinic, just with people, getting the brain back and getting that memory snapshot the way it should be.
It's interesting because omegas, these type of products, and specifically Zenzino, is not something that you would imagine has some sort of immediate effects. In fact, on the contrary, most research says that you need to be taking omega supplement between 6 weeks to 6 months to feel a benefit. In this brain health category, this is the one that we see the fastest response from me personally and in the clinic. And I always say this to people, if we look at what are the raw ingredients of any cake, you've always got, your eggs, your flour, your water. Well, let's look at the brain. The brain is basically fundamentally water, electricity, and fat. And your brain needs these fats, particularly not only the DHA, by the way, which is a component of omega-3, but also the EPA, depending on the specific problem that we're dealing with. So I always say that you need to feed yourself these fats. And let's not forget the important principle, omegas are called essential fatty acids. Why? Our body does not make them ourselves. We do not produce and we do not create omegas. It needs to come from a supplement or food source. In 15 years as being a clinician, I've never come across an omega product which I feel that has such rapid and systemic and profound results like Zenzino does, number one. And number two, I've never come across anyone who I would hand on heart say, your diet is omega rich every day to get the sort of benefits that we look for. So, I deal with all sorts of problems. I've seen some, in fact, some of the most profound ones have been in the neurological areas. So I've had some patients who've had epilepsy and narcolepsy. These patients, particularly, several of them have had remarkable benefits, seizures stopping. In fact, I'll just tell you, I'm not much of a testimonials teller because I prefer facts and science, but just to give you an example of one patient, very early on when I decided to use this product in clinic, he was a patient who had smoked marijuana. And unfortunately, that for him had created a condition known as drug-induced epilepsy. And so this particular patient started having seizures. He was having between 4 to 6 seizures a week. And of course, because his seizures were not neurological. They weren't the result of a injury to the brain or something like that. Typical anticonvulsant epilepsy medication just wasn't doing anything. In fact, they were probably making it a little bit worse. So this gentleman doesn't live in this country; he's overseas, and we were organising some supplements to be sent over. But I was able to straight away get him to purchase the Zenzino Balance oil from his country. And he got it very quickly, of course, and he started taking the product, and his seizures pretty much stopped within the first week. In addition to that, and this is something that I hear all the time, well, I don't know what you've given me, but I have started to dream. All these people go through their life not having any dreams. And that's a really sad thing. And let me just touch on the importance of that. We need REM. REM means rapid eye movement sleep. That stage 4 and 5 stage of our levels of sleep is such a critical thing. In fact, you can go crazy from a lack of sleep. In fact, you can die from a lack of sleep. It's almost akin to, in fact, I believe it's second after lack of water. And food, by the way, is like further down the list at number 4 or 5. So a lack of sleep will make you go crazy and you'll die from it. And the importance of that is because like our old computers that we used to have, where we used to do these defrags. We used to go through and we used to clean up the software in the background. That's what your brain does when you sleep. And so dreaming tells us that, well, you're going through REM. Your body is decluttering, reorganizing itself, filing stuff away, deleting old files and stuff like that. But look, seriously, when we look at this product and omegas in general, we see that they have profound influence on mood disorders, mental health, bipolar disorder, schizophrenia. I've had very good results with patients with these struggles. Memory, recall, retention, intelligence. In fact, I urge every single mother that is either breastfeeding, pregnant, or going to try to become pregnant, you need omegas in your diet, because omega levels and lipids in a child's brain, to some extent, based on some studies, can almost predict the intelligence of that child. So we want to really maintain that when we look at children with special needs and learning disabilities, which is there's a plethora of them today, autism, ADHD and the like. We see remarkable, particularly I've had some great clinical outcomes with children with ADHD. It's fantastic outcomes there. And finally, like I touched on before, anything neurological, narcolepsy, epilepsy, dementia, Alzheimer's. I mean, the list can go on and on. Migraines, headaches, the amount of people that walk around popping Nurofen every day. And, I tell them all we really need to do is give you some good quality omegas, maybe a bit of magnesium, and that's pretty much it. Let that do its own thing. And in most cases, migraines, headaches just disappear. I mean, it's an amazing thing, isn't it?
Look, in my opinion, when I see people exactly what you're saying, they call me, again, I'm just in the industry. I'm not got any, college degrees or university degrees. I've just been what I call at the front of the wellness industry for 22 years. They call me and they tell me some of the results that they're having. And again, I say, hey, you can't make product claims like that. Please don't go tell the world, okay? But I'm so happy for you that the only thing you've added into your system, okay, is the Zenzino balanced oil. I know that's the only thing, but we haven't done a double-blind case study on that particular case. So, I know you personally have had great results, but, I'm happy for you. And the amount of people, ADHD, brain function, heart function, immune system, the list just keeps on coming and coming. And, I just put it down to that the oil works perfectly with the cellular structure. And when we can get those cells working correctly, it's amazing what this human body, what it can do, okay, to protect itself or to get itself working the correct way. All right, so I'm going to wrap out just in a few things here, okay, Dr. Idris. Just for those guests that are online and those people watching the replay, we're talking about the Zenzino balanced oil. This is an incredible product that is used now in many wellness professionals practices around the world, okay, in all the 37 countries we're open in and shipping to an extra 61 countries and a not for resale process. The balanced oil, orange lemon mint, is our #1 seller. The second seller, which is just coming through now, and this is brand new technology, this is our premium oil. It's a little bit more expensive, but it is 4 times stronger with the polyphenols, okay? So this product here, again, Australia has just started seeing this product in the last week or so. Guys, make sure if you're in this region, okay, Hong Kong, China, in this APAC region, get some of this product and just try it. You'll be blown away. Our #1, what I call defense for the Omega industry, is make sure you take the balance test, #1 priority. That's the first thing. You must have a starting point and then your finish point, which is I call day 120. I like to always recommend as well day 240 and day 360. So in the first year, you're having about 3 balance tests to test your system because you want to see what your cell system's doing. Now, from my side, guys, and Dr. Idris in his practice, okay, he has what we call a Premier Kit, which is a 2-month supply of product for the first 2 months. Comes with 2 bottles and also 2 small bottles. The dosage is by weight, okay, so talk to the person that's connecting you with the company as a customer and just find out your weight and how much you need to be taken. Or the sensible thing is read the label on the bottle, okay? Not many people do that. We know that, okay? It's sort of guess. They grab it and have a swig, okay? You can do what you want. One of the beautiful things is it is an omega oil, okay? It is an olive oil. So guess what, guys? I'm not going to say you can't overdose on it, but you'd have to drink a lot of this oil to hurt yourself, okay? Because it's going to just give you a good case of the diarrheas and just flush out the other end. The other thing, guys, that I love as well is that we do have a full range of products as well called the Health Protocol. For an example, up in Hong Kong, China, and other regions around the world, we have an incredible nutritional product, and we have a great, what we call Viva, a wellness product. So these 2 products added with our prebiotics, incredible products. So I want to make sure that you get connected with this incredible brochure, our wellness professional brochure. It will detail for you all the information that we've spoken about tonight. So the person will share with you all the key details you need to know. And then our customer offer brochure, which will detail about our subscription program that comes with it. Now, in those 61 markets, and I'm going to use the Philippines for one moment, okay, we have an incredible program there because we do the balance test and the oil. It's called the mini kit, okay? You can get access to this in those countries that the product's only not for resale. So make sure if you're in one of those countries or you're watching the replay, make sure you get access to this incredible product as well. But remember, the balance test is the key to start the whole program. Dr. Idris, it's been great having you online. What I'd like to do as we close out, because we've got about 1.5, 2 minutes to go, talk to me just a few closing ideas or concepts that you see all the time that somebody just listening to this for the first time and saying, listen, you spoke about this cell membrane being hard. You spoke about the brain being water and a bit of fat, okay? You speak about the heart being blocked. What are some of the health things you'd say to a person? What they need to go do now in getting the balanced oil, getting it into their system, and then where they need to move from that point onwards? Give us a 1 or 2 minute closeout.
I think that, I mean, it's hard to walk away from my personal passion when it comes to omegas. Obviously, that's our first thing because we don't make it ourselves. It's a missing link as far as I'm concerned in terms of people's general health and well-being. And in addition to that, I guess there are so many other options out there. One thing that I always educate my clients on is eating according to your blood type, which is a very important principle. It's an old naturopathic principle. It was developed by 2, in fact, a father and son in the US who are both naturopathic doctors. And I find that to be a very important principle to live by. Find out what your blood type is and then find out from an expert what you should be eating according to that blood type. Fiber, very important, that biotic type product where we're having some prebiotic fibers. That's a very important thing. And then I guess finally it would be a matter of building up your immunity in terms of having an omega product and maybe a probiotic. I think that, you know, us living out there today, we have so many wonderful resources available to us. And I can't imagine a better starting point than Zenzino. If I had, let's just say, you know, I've got 12 patients tomorrow. If I happen to have all 12 patients ask me, hey, I've only got the budget to take one supplement, one medicine, one something, what would it be? Almost regardless of their health problem, it would probably be Zenzino Balance Oil. Just because I've seen how effective it is. I see that from a clinical perspective and from a research perspective, the need for this in our body and its long-term health benefits. So for me, I would say that, you know, start off getting a balance test done first, get onto the oil. I absolutely love, and this is the only omega product I have ever seen in my 15 years in practice, that is dosage based on weight. I can't tell you how much I admire and love that. It's always take one capsule a day, take 5 mils a day. And I've always had this argument with people that it is not sufficient because we're all different. My wife is a tiny little Indonesian woman compared to me. I'm a big, bulky guy. You know, we have different nutritional needs. So this is dosage based on your weight, and I love that.
Outstanding, Dr. Idris. And again, I thank you for your time, energy, and power today. You've just empowered us with some great information. And if you're watching the replay, guys, hey, reach out, listen to this information, and share it with anybody you want. These programs are made for you guys to listen to, educate yourself, about the Omega platform and the Zenzino Balanced Oil and the Zenzino Balanced Test. So do what you have to do. Hit that share button. Dr. Idris, again, I appreciate your time for coming on and sharing. Next week, we got another great practitioner here from Australia, from the Gold Coast, Australia, okay? Dr. Liz, an incredible lady in practice as well. So same time next week, jump on, listen to another practitioner that is actually out there talking about the Zenzino Balanced Test and the Zenzino Balanced Oils in their practice. Dr. Idris, thank you so much again. Look forward to seeing you. Hit that share button, guys, and have a outstanding time with this incredible product. Thank you, guys. Take care. God bless.
Thank you, Robert. Thank you.
Okay. Thank you, Dr. Idris. Bye-bye.
Bye-bye.